Welcome to Health Professional Radio. I'm your host, Neil Howard. We're going to be speaking with Dr. Jacob Sands from the Dana-Farber Cancer Institute, and he's also an instructor of medicine at Harvard Medical School, joining us to talk about an initiative with Merck in collaboration with the GO2 or GO2 Foundation for Lung Cancer. The initiative is called Worth the Fight, Taking on Lung Cancer. Welcome to Health Professional Radio, Dr. Sands.
Yeah, thanks so much.
Well, give us a little bit about yourself, and let's talk about this Worth the Fight initiative.
Thank you. So I'm a thoracic medical oncologist at Dana-Farber. I see all patients with lung cancer. And so the initiative is something where GO2 Foundation and Merck came together. They put out a survey to patients, caregivers, medical staff that highlighted some of people's perceptions and patients' perceptions when they're first diagnosed and what's helpful and what they're experiencing. And essentially, the bottom line is that within that, 21% of those diagnosed do not go on to receive treatment. Many patients end up feeling hopeless and defeated initially. These are some of the terms that come up within the survey. And people question, is it worth the fight? And as a thoracic medical oncologist, I certainly see people who come in to the clinic and their initial impressions or their initial thoughts or their initial beliefs about the options in lung cancer and how realistic treatment is to impact their quality of life. People come in with impressions and concerns and their mind swirling and not knowing what to ask and not knowing what to believe. So I certainly see this every day that I'm in clinic, that this is a real issue for people. So the initiative is a way of coming together, providing them with a bit of a layout of how things, what's happening in lung cancer, what questions to ask, so that when they go in, they're a little more prepared and able to get more out of that interaction. That initial interaction, so that they can feel like get their feet on the ground a little bit faster and make decisions. And so there's a website, www.fightlungcancer.com that patients are directed to and hopefully are able to review before going in, so they feel like they have their feet on the ground a bit more. And that's kind of the quick on the initiative.
Would you say that the goal of the initiative is more to convince people to get care where they might not want to, or just to educate them and give them more insight into their options to make a better informed decision?
It's not trying to skew any decisions about care. It's really just making sure people are informed so that they feel like they've got their feet on the ground, so they're able to make the decision that works best for them. And that's really something we encourage people to do with their doctors and have a discussion about that. But I see this every day where I think people coming into the clinic, if they feel like they have a little bit of a sense of the map that they're looking at, then we can kind of choose a direction. But sometimes coming into that office and first talking about it, part of my job is as a medical oncologist is to recognize when patients are being overwhelmed by the discussion or when their mind is swirling, and trying to bring them back into the room to kind of pick up where their mind lost track of the discussion. And it's a lot to handle at first. And of course, it's a very emotional experience. So by having some kind of map to start out with, or even just a list of questions, I commonly hear patients say, what else should we be asking? What would you do if this was your family member? These are ways of getting at what am I not asking? Because I think people feel so overwhelmed they don't even know what to ask. And so this is giving them some of that. This is giving them a way to be able to be more comfortable going in there. Okay, these are all the questions I need to ask so that I can really be informed.
Well, let's talk about some of the other feedback that you've received about the initiative from people involved and those who are taking advantage and reaping some of the benefits of this initiative.
Well, the initiative is just starting, but I will point out that within the survey that went out, in the beginning, patients say that they don't really, that they feel overwhelmed, they don't feel informed enough to make treatment decisions, and that in the initial they're kind of just leaving it up to their doctor, which for some people makes sense, and I think for others they want to be more have things laid out a bit more so they can more actively choose the path that they want to walk with this. But that with time, they come to then understand things more, and there is a level of trust that's developed. So I think what we'd like to see is, rather than that happening over time, is just how can we make that happen from the beginning? How can patients walk in to that first visit and make sense of it to in a way where they can feel like they really know what's going on, and they feel comfortable saying, okay, here is the way that I want to fight this. And, it's kind of worth the fight, because we see people come in with a lung cancer diagnosis, and there are a lot of beliefs about what that means, or whether there are really options or how effective options can be. And within the last 10 years, we've seen a lot happen. So there really is a lot to learn about in figuring out what is the best treatment for me if I, as going in. So if we can give people some of that framework, some of that map, help them get their feet on the ground a little bit, so that when they go in, those first discussions with their doctor can be more clear, and people can walk out feeling more clear about what's going on, knowing that they've asked everything they need to, and knowing their options, and having a more realistic idea of what fighting lung cancer is now. Because so much has happened over the last 10 years. I honestly, I think that there are a lot of people, even in healthcare, physicians in other fields, that are surprised to hear about what's going on. And so for patients, getting some understanding of that ahead of time and what to ask helps them understand that better when they're dealing with such an emotional experience of having just gotten diagnosed with lung cancer.
What are healthcare providers taking away from this initiative? I hear a lot about, the patient and, what they can expect and the questions they should be asking. How's the mindset of the provider being changed when it comes to dealing with people who've been diagnosed?
Yeah, I think many medical oncologists recognize the challenge of that initial visit, and how to help patients really get their feet on the ground. And frankly, for many oncologists, it's really helpful for patients to have looked over this kind of stuff ahead of time. There's so much information out there that if people just Google, then they end up on various different blogs, which, sometimes have useful information, or sometimes it just becomes information overload, and it just kind of adds to all the swirling. But medical oncologists recognize patients coming in, that is how that first visit goes, is how do you help them get their feet on the ground? How do you help them feel like they understand enough? Because it's hard to help people understand everything. So how do you get them to enough that they then feel comfortable with what's going on, or at least understanding what's going on enough to feel like they can make a decision going forward of getting care?
This is a collaboration between Merck and the GO2 Foundation.
Yes, it's Merck and the GO2 Foundation. So the GO2 Foundation is a merger of two patient advocacy organizations focused on lung cancer. So this is a large patient advocacy organization on lung cancer that has really been fighting for years how to push the field forward, how to advocate for patients, how to help patients understand all of the things that they need. We have some amazing advances that have happened, and frankly, not every patient is getting the full benefit of all of those advances. And those advances are across a wide spectrum of multiple different kinds of lung cancer, really. So how do we make patients more aware of those, so that really everyone gets the full opportunity in the fight?
You gave us a website earlier in our conversation. Can you give us a website where our listeners can go and get some more information about Merck and the GO2 Foundation for Lung Cancer's initiative?
Yeah, so they have this website, www.fightlungcancer.com. And that's a site that patients and caregivers and healthcare practitioners can go to see what is kind of a framework for patients and what they should ask going in to get a better sense of all the options there are.
Great. Well, Dr. Sands, I thank you for coming in this morning. Really appreciate it.
Yeah, thanks for taking the time to highlight fightlungcancer.com.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Jacob Sands. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au.